First and foremost, it is an experiment. Unfortunately, that's the way it goes. The first study that we move into the patients is an experiment.
You are putting an experimental drug into your child, and is it worth it? Is it worth the side effects that we don't know what those are?
I mean, I kind of, when he's getting the infusion, I'll sit there and I'll look at that dripping in, and I just think, okay, there's some unknown compound going into my son's bloodstream.
There will always be a safety issue. You're putting something that's foreign most of the time into the body. And so there's always going to be a potential issue and something unexpected.
I'm hopeful that the folks designing the trials and doing the research have done enough background that there's, some assurance of safety.
I look at the data from the other trials, like the animal trials. What were they like? What kind of background testing did they do?
I'd look for side effects and what the sponsor anticipates this product will do.
You can't know for sure that it's going to be safe. It's a trial. You have to make an educated decision based on what you know and what risks you're willing to take.
I know how much research goes in behind the scenes, so by the time it gets to a point where you're enrolling the children, that hopefully people have sorted out a lot of the negative potential side effects and those types of things.
Because my son had a negative experience with a clinical trial.
I don't care what the doctor's going to think. If I'm not comfortable, it is my right and my son's right to pull the plug.
You do have a right to halt your participation in the trial at any time.
It's important to talk to your son and see what willingness they're willing to take and be honest with them, as honest as you can be.
And yes, there's side effects, but there is side effects to pretty much everything.